All right. Today's lesson, boys and girls, is going to be on mask shaming. Make sure my microphone's working here. This is an area that I hold near and dear because I see it everywhere. I'm seeing it go on all the time. I live in Austin, and it's a very liberal city. And they're predominantly a very young city, and there's still a lot of shouting down and anger. So I would like to address some of that shouting down and anger. Whether you think that a mask is helpful or you think that a mask is not helpful, you only think it. You do not know. There is not a single person who knows for sure. You can say it's logical. You can say it's illogical. I don't care what you say. All I'm trying to make the point of is that you don't know. There is no objective evidence for it. But first, let's talk about why we would wear a mask. Let's go back to the whole reason we did anything differently. When the COVID virus, when this COVID illness first started hitting America in substantial numbers, we thought that this was the most deadly virus we'd seen in our lifetimes, that it was super contagious. There was a lot we didn't know. We did a lot of modeling. We put assumptions into the models. We put worst case assumptions into the models because that's what modelers do. They are there to minimize risk. So they are looking for the worst possible case. The worst possible case was too severe to not do anything. So we said, all right, we have to do something. We're going to shelter in place for 2 weeks. Sheltering in place, euphemism for house arrest. We're all going under house arrest under threat of legal action if we leave our house. That's what house arrest means. But I digress. No matter what you think of that, we did that. Why did we do that? We didn't do that so that fewer people would get the virus. We did that so that fewer people would get the virus immediately. We didn't want to overwhelm the medical system. We didn't have an effective treatment for it, and we still don't. We didn't do that to wait for a vaccine. We didn't do that to wait for an effective treatment. We did it so that we didn't overwhelm our medical system. America overall is on a rapid decline. New York, New England is half the country's cases. They're on a rapid decline. There's no doubt about the fact that things are getting better, okay? We didn't come anywhere close to overwhelming the medical system. We built filled hospitals that never got used. We brought in Navy hospital ships that never got used. I'm not saying this to criticize anybody. We did the cautious thing, and the cautious thing maybe helped. Maybe it didn't. We don't know. And here's why we don't know. Sheltering in place. This was the thing that was going to save all of us. New York, of course, had the most cases. They have a high population and a high population density. What came out recently? 66% of all recent cases have come from people who aren't actually leaving their homes. They're getting it at home. Now, here's the other big, ugly secret that nobody's talking about. 40% of America's deaths, 40% of deaths worldwide probably, but about 40% of America's deaths are coming from nursing homes, old folks' homes, hospice, things like this, okay? I'm not saying that to be callous. I'm going to expand more on that in a minute. But we didn't overwhelm the medical system. We weren't trying to reduce the number of cases. Why weren't we trying to reduce the number of cases? Because we can't, okay? Think about viruses, how small they are. If you've listened to my other videos, they're unimaginably small. If you've walked into a room, looked through the window, you've seen some dust glittering in the sunlight, Dust is orders of magnitude larger than a virus. Okay. This virus we know is airborne. If you have an air conditioner in your house, you have an air conditioned filter, that's thicker than your mask. It has multiple layers to filter. And if you look at it, it has a bunch of dust on it. When you go to replace it, there's too much dust on one side, but there's dust on both sides because dust is still getting through, as evidenced by you still having to dust your house occasionally. So we aren't going to prevent everybody from being exposed to this. And in fact, that might not even be a useful thing to do. I want you to think about this. If every single person in America gets exposed to this virus in the next couple of years or the next couple of months, and it doesn't overwhelm our medical system, what is the difference? And people will say, okay, you don't care about people's lives. That's not true. Let me do a little screen share here and let's talk about saving people's lives. So right here on this screen share, this was research done in the Netherlands. You can go, so this was April 16th. They came back and did a follow-on study that was a little more elaborate than this one, but basically there were 4,000 people that were blood donors. They were testing the antibodies. From those antibodies, they figured out what the fatality or what the incident is, how many people actually have this virus. Extrapolating how many people have the virus, they then said, okay, well, here are the number of, here are the number of cases that we've had, how many of them hit the hospital, how many people died, how many per numbers. So then they age stratified it. This is the number we've been needing all along, okay? You can't treat the entire population like they're one homogeneous group. Not everybody is at equal risk. So what do we have here? 0 to 19, chances of death rounds to 0. 20 to 29, chances of death rounds to 0. 30 to 39, chances of death rounds to 0. It's not until you get here, 50 to 59, that we actually have not even a 1% chance of going into the ICU, about a 2% chance of going to the hospital, less than a 1% chance of going to the ICU, and about the same risk of dying from the flu. This is higher than the flu, 60 to 64. This is higher than the flu. And when we get up into 70, 75, and 85, we have a higher rate. But if you age stratify this, it's not hugely different, okay? If you age stratify the flu, and I know this isn't the flu, don't bother shouting at me about that. That doesn't make any sense. I'm not saying that this is the flu. It's a lower respiratory illness like the flu and like many other infectious agents. And we can calculate the death risk of them. And if you age stratify the flu, it looks very similar down here. However, it doesn't look similar up here, because when you go up here, kids die from the flu too. Okay? A lot more kids die from the flu than die from this. Orders of magnitude, many orders, multiple orders of magnitude, more kids die from the flu than die from this. And about the same number of people in these two age brackets, maybe it's a little higher. Once you get around 80, it's the risk of dying from COVID is significantly higher than the flu. However, you also need to keep in mind that the age expectancy, the death, the age which Americans are expected to die by, like your life expectancy number, is only between 74 and 76, depending if you're male or female. So these people are likely to die from anything, not just COVID. These people currently aren't dying from the flu, and they aren't dying from many other things because COVID is being counted as the number one cause if they have COVID. And if you go to a hospital and you're in an ICU, you're going to end up with COVID. That's the way it works. Okay. Now I'll stop screen sharing that. Go back to me. So if you think that you should be shouting people down and telling them they are horrible people or not wearing a mask, and you're so convinced of this, I want to know how you're convinced of this. I'm not saying that people shouldn't wear a mask. I personally don't know if people should wear a mask. I'm really, 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 really doubtful that being outside with a mask makes any sense. Being in your car with a mask makes any sense. Riding your bicycle, jogging, these things do not make sense. However, if you're saying, well, we should wear a mask inside, okay, I'm not going to argue whether that's a good idea or a bad idea. I'm going to talk a little bit about the science of that in a second. But if you're shouting people down and you're saying with verisimilitude, I know for a fact that you are killing people by not wearing a mask, well, then you need to wear a mask for the rest of your life. Because if masks are preventing you from possibly infecting somebody else who may eventually die from an illness, why is that any different than the flu? Why is that not the same? And you, if you don't wear a mask for the rest of your life, by your logic, you want to kill kids and old people because kids die from the flu too. In fact, all age groups are more likely to die from the flu than from COVID, except for the extremely elderly. So there's no logic to the argument that you absolutely know for a fact that masks help. Now, do masks help? Probably they make some difference in certain circumstances. But let's talk about what those circumstances might be. So as I've covered before, there are two different ways that breathing can get viruses out into the abyss where they might get other people. One of those ways is through aerosolization. So your little bitty water droplets, all the way up to sputum, like bits of saliva from coughing and sneezing. That's all into the aerosolization pathway. But you can also just have an airborne virus. It can just be floating in the air. And we've covered this before. The mask that people are making at home don't make any sense when you're talking about I'm going to stop a virus from going through this mask and getting out into the air where it might infect someone else. Supposedly the dogma is that you're wearing a mask so that you don't infect somebody else. It's not going to help you not be infected. It's not going to prevent you from getting infected. I don't buy that logic either. So let's take a few examples. I make a homemade mask here. I take a bandana, okay? Now, a bandana, you can see through, okay? Why can you see through it? Because it has a bunch of holes in it. So the smallest hole that you could possibly see, if you hold this up to the light, and there are millions of them as I look through here, the smallest hole that I could possibly see, the smallest one, not all the holes, just the smallest hole, this 0.1 millimeter, that's what the human eye can resolve. So that's the smallest I could possibly see. A virus the virus we're talking about is 10,000 times smaller than that. You are trying to stop a BB gun with a chain link fence. All right. I did the math earlier in another video. If you enlarged the virus to the size of a marble, a 1-inch marble, the smallest hole in your mask would be 83 feet in diameter. So while it may catch droplets if you're coughing or sneezing, and if you're coughing or sneezing, you should be covering your mouth. That's why we cover our mouths. If you're coughing or sneezing, you could stop particles that are in fluid that will get stuck onto your mask. More on that later. You aren't going to stop viruses that are just in the air and floating on your breath, essentially, in the actual air that you're moving through your lungs. Just like there's dust particles, many orders of magnitude smaller than that, there are virus particles that are also floating. It is very possible that there are more COVID viruses floating around on the earth right now than there are grains of sand on the earth. We don't know, but it's a very, very, very small thing. Now let's get back to the mask. So if I put this mask on myself and I say, okay, I'm doing this so that I'm going to protect you. Now, I have this, I'm not protecting myself. Why am I not protecting myself? Because I can still breathe virus in, but I can also breathe virus out. So how am I protecting anybody else? Not to mention, it can land on people's eyeballs and they can get infected then. So we could both be wearing a mask and it still wouldn't stop it completely. Now, would it? I'm not saying they don't do anything. All right. I'm a doctor. I've spent lots of time in lots of hospitals, lots of surgeries. I know about wearing masks. And something that I know about wearing masks is that when you put on a mask in a surgical setting, you're putting on a mask so that you don't get your cooties on the patient. And here's something else that nobody's thinking or talking about. As soon as you touch your mask, as soon as you bump it with your wrist or you move it on your guess what? You're out of the OR. You don't get to be in there anymore because you're contaminated now. And why? Because your mask is contaminated. So if you go on PubMed and you look up the research on mask, within the last 3 to 4 weeks, there's been a lot of literature reviews that have gone through and looked at all the research on mask and come up with their conclusion. Now, a month ago when I did a video on this, those things weren't there. And so I looked at the actual research, and the actual research is not very convincing. What it did find is that when they put these type of masks on people and they had them cough, the virus, of course, went through. They collected them on like a petri dish on the other side. This side of the mask, the outside of the mask, had virus on it. The inside of the mask had virus on it, but the outside had more virus than the inside. So if we are going to wear a mask, we have to admit the fact that these are virus beacons. These are little collecting dishes for the virus. Now, this is just one of those cheap masks you get at the grocery stores or whatever. And of course, there's 3 layers here. You can see through that one quite easily. You can see through that one quite easily. And this one's like filter paper, and it's not as easy to see through. But if I hold it up here, I can see tons and tons of holes. So this probably does a better job than this, but not necessarily enough to be effective. I've read that as few as 100 virus particles is enough to infect somebody. And when they measure how much people are exhaling, they're measuring this in numbers of 10 to the 7th, 10 to the 5th, 10 to the 7th. So that's 10 and 7 zeros or 10 and 5 zeros. So the homemade mask, I think, is just I think it's an attempt to make people feel better. There is absolutely zero, and I mean zero science to say that homemade mask does anything. Even all the literature reviews that are published on PubMed right now that have come out in the last 2 to 3 weeks that are trying their best to support mask wearing, they say the same thing. There's no evidence anywhere that putting a scarf or a bandana around you is going to do anything for anybody. You can argue that it's logical, and that's okay. Argue that it's logical all you want to. But let me tell you about an experience that I had. I went to the grocery store yesterday, and the teller had on his mask, right? Just like this. And the person sacking the groceries had on their mask. and the customers had on their mask, and there was plexiglass in between them. And of course, nobody could hear anybody. And so they kept asking questions, and then the teller would go, I said, and he would say something, and then he'd put his mask back up. And he'd be talking to the girl who was putting the groceries in the bag, and she would say something, and he would say something, and they go, what? And they would pull down their mask, and they'd talk to each other, and they'd put it back up. Okay. Oh, yeah, now we're fine, and now we're safe, and I'm going to go. Now, this person who's touching their mask every 30 seconds, this petri dish, this collection device for viruses, if this person has a virus, we know it's super concentrated on this now, and he's touching it 50 times a minute. And then he's going to reach down and grab my groceries and slide them to the woman who's putting them in the bag, and she's going to touch it after she's been doing her mask. I'm going to carry those groceries home with me, and I'm somehow safer. Surgical masks work for what we use surgical masks for, and they work under very strict circumstances, which is why you aren't allowed to touch your face when you're in surgery. You can't touch your mask ever. You can't touch anything, or you're contaminated. This is, again, it's like trying to get air. It's like trying to prevent yourself from being exposed to dust. You're going to get exposed to dust. All right. So that's what I'm going to say about masks. I'm not saying I know the answer. I'm not saying that they're absolutely ridiculous. I'm not saying that they're absolutely useful. I'm not saying either one of those things. What I am saying is that you don't know either. I don't know. Nobody else knows. The World Health Organization, everybody keeps saying trust the experts, except those experts, because those experts are saying don't wear masks. And a few months ago, our experts were saying don't wear a mask. And a few months ago, all of the research we've been doing for 20 years on masks said don't wear a mask. And now we should wear a mask. And I'm not saying it's right or wrong. I'm saying nobody knows. So don't be certain, and don't go around starting fights and yelling at people and telling them that you know that they're trying to kill people because they don't care about other people's lives. People just don't do things that they don't know there's a good reason for. So the other thing to consider is it even a good idea to be trying to stop this? If you remember the sheet I just showed you, the elderly are dying. What I said earlier, 40% of cases in the U.S. have been dying. I think New Jersey has like 76% of their deaths have been in hospice and retirement homes. We know who's dying from this. It's also a population that's really easy to isolate because these aren't people that are by and large traveling a lot and going back and forth to work, and they're not the most active people on the planet. The younger people are the more active people, and the younger people are not at risk. I just showed you the chart. And this is one source of the data, but the data is coming out the same all over the place, that the death rate of this is not that great. It is more contagious for sure. It's probably, I would even accept the argument that it's more deadly than the flu. However, we don't have a cure for it. We don't have a vaccine. We don't know if we are going to get a vaccine. And keep in mind that a vaccine is like, it's like a metaphor. It's a simile for the virus. It goes and you put it in your bloodstream and it looks like the virus, and you develop antibodies to it because it looks like the virus. If you actually get the virus, you get immunity to the virus as well. If getting the virus doesn't provide immunity, well, then neither will a vaccine. And it would be one of the only viruses we know of that as far as I know, it would be the only respiratory virus that we know of that isn't protective once you've had it, at least to some degree. So the next worst case of pandemic that we've had, and well, it's not the next worst, but the worst case that would be in anyone alive today's lifespan was the 1918 Spanish flu. And what people don't understand about that, by and large, One is that it was killing young people. It was killing people, primarily it was killing people like 28 to 36 years old. But the other thing is that it wasn't a one-time event. The virus came back several times, 3 times, I believe. I know at least twice, and I'm almost positive it came back 3 times. The first case was not deadly. The second time around it came, it was more deadly. And the third, it was obviously the most deadly. Now, I say that because viruses mutate. So if you stay in your house and you wear a mask every time you do anything outside of your house, and you wear gloves and a face shield and everything else, and you do your best to protect yourself from being exposed to this virus, again, good luck. Probably not going to happen. But if you can somehow prevent yourself from being exposed to the virus in the next 6 months or 9 months, and the virus mutates and the virus comes back and it is more deadly, and it is killing 20-year-olds, and it is killing 50-year-olds, and it is killing healthy, robust young children, there's a possibility that getting the virus right now might protect you from that mutated strand that's more deadly. It's about the same possibility that a vaccine would protect you from that mutated strand. So my point is, no, we still don't know very much, okay? All we can do is we can compare this to other viruses, the way other viruses behave. And the most likely thing is that this virus is going to blow through society. It's already killed people. It's going to kill more people. Of course, once we open things back up, it will kill more people. There's no way around that. Of course, that's going to be the case. The more people who get it, the more people will die. But that doesn't mean the higher percentage of people will die. And if you can't avoid it, what is the end game? What is the end game? What is the idea? I'm just going to wear a mask and sit in my house until I die from starvation? Or what? Like, where's the end game? You're going to wait for a vaccine? You don't know a vaccine is coming. You're going to wait for a treatment? You don't know a treatment is coming. How long can you wait? How long can people wait? So I believe we should be protecting the vulnerable, the people we know that are at risk of dying right now. And we should be doing our very best to acquire herd immunity through everybody else. And I'm not saying that means you never wear a face mask or you don't social distance and we throw caution to the wind. What I am saying is that avoiding this as though it's going to kill you instantaneously if you happen to get it, it's probably a foolhardy idea. The most useful thing we can do right now as a society is to have some courage around this and make some tough decisions. More people are going to die from this, no matter what we do. More people are going to die from all causes, no matter what we do. People always die. Every day of the year, people die. That's not going to change. We can't get this down to zero. The more people that are exposed to it, the more people will have the disease. The more people that have the disease, the more people will be hospitalized, and so on and so forth. However, again, it's not a higher percentage, all right? It's not a higher percentage. And overall, it's not very deadly. From the numbers that I've just shown you, it's not very deadly. I do believe it is deadly. It does kill people. I do believe it's probably more contagious than the flu, than any of the flus that we currently track. But unless we're all just going to hide in our houses forever, and the research and the data in New York City showed that we still have 66% chance of getting it from our homes, there's not much else we can do. So let's not run around absolutely sure that we know what the hell we're doing, or that anybody else does, or that somebody's right and somebody's wrong. Maybe we need to wear a mask when we're in close proximity to other people. Certainly, if you have the virus, you should be wearing a mask. That, of course, makes sense if you go anywhere. If you think you might have it, if you have symptoms, if you're coughing and sneezing, of course, wear a mask. Why wouldn't you wear a mask in those situations? And if you don't happen to have a mask, you do what we've always done, and you cough into your elbow and you whatever. You cough into your hand, you cough into a cloth, a handkerchief, whatever you want to do. Wash your hands, disinfect countertops and other surfaces. Do the things that we know you should be doing anyway. And a lot of people say, well, that's easy to say, just sitting around, and you're not, you're sitting around your house and in your office, and you're just making these videos, and you're doing this in your own little bubble. Well, I got a surprise for you. I actually have a roommate. I live in a 1,000 square foot, 100-year-old 2-bedroom bungalow right on the skirt of downtown Austin. And the person that I live with has tested positive for COVID last week. And you know what we're doing about it? Absolutely nothing. He's doing his best to recover. His symptoms so far is he feels kind of tired. He's outside working on his car right now. It's like, the flu for him. And it's not even a bad flu. I will almost certainly have it myself because of the environment that I'm currently living in, if I don't already have it. And I will keep you updated. But I can tell you that my fear level is 0. My hand's not shaking. I do not care. I'm looking forward to getting this, developing some immunity to it, moving on with my life, just like I do with every other virus. The 265 trillion viruses that are in my body right now, those aren't killing me either. So this is just another one. And I'm not going out because I'm living with somebody who I know has COVID. I think that would be very irresponsible. If I did for some reason have to go somewhere, of course I would wear a mask. I would stay away from everybody. And I don't see why that would happen. But there you have it. That's the video for today. And I welcome all your hate on Instagram. It gives my employees something to read because I don't read any of it. So don't waste your time on me. Sorry, this seemed very contentious. I didn't mean it to be contentious when I started, but I got a little worked up of it. Bottom line is, some people think we should wear a mask. Some people don't. Nobody knows. And if you are absolutely convinced that you are correct, I just want to assure you that you don't have to be correct to be sure. It's very possible that you are absolutely certain and you're still absolutely wrong. So love your fellow man and neighbor, and let's try to get through this with a little bit of mutual respect. Respect other people's freedoms and other people's opinions. And if you don't want to be around people who don't have masks, don't go around people who don't have masks. And if people who don't want to wear a mask want to hang out, we should let them do that too. Because like I said, none of the bad modeling has happened so far. All of the reason for wearing the mask is based on modeling. And again, the modeling didn't work the first time. It's never worked historically. So take it with a grain of salt, take it for what it's worth. Be well, try to be decent to each other.